Bismillahirrahmanirrahim. I'll get through summarize the cardiovascular system. The spinous ligamentous ossification is also noted. Question number one, spinous ligamentous ossification is also noted. Diagnosis, ankylosing spondylitis. Okay. All get through summarize cardiovascular system. Question number one, spinous ligamentous ossification is also noted. Diagnosis, ankylosing spondylitis. ठीक है. ये ankylosing spondylitis की इमेज ये तीनों ठीक है. इसमें कि बैम्बू स्पाइन होती है और अच्छा एक मिनट अगर टोक्स में आ गया तो ये एंकलोनिक स्पॉन्डिलाइटिस है. बैम्बू स्पाइन होती है. वर्टिकल स्टिफनेस मस्पाइट noted throughout the lumbar vertebrae. Bilateral sacroiliitis with sacroiliac fusion है. Vertical calcification involving the interspinous ligament dagger sign. तो ये क्या रहेगा? Spinal ligament ossification seen ankylosing spondylitis. ये बाकी सब टॉक्स तैयारी के दौरान पढ़ेंगे. तो ये है कि spinal ligament ossification seen ankylosing spondylitis. ठीक है. ये spinal बीच ये इसको dagger sign कहते हैं. ठीक है. Spinal ligament ossification seen ankylosing spondylitis. Question number 2. In acute respiratory distress syndrome, what is the first change usually seen on the chest radiograph? Patchy ill-defined opacity. ठीक है. ये acute respiratory distress syndrome है. ये transient tachypnea of the newborn है. This is transient tachypnea of the newborn. In acute respiratory distress syndrome, we can see patchy ill-defined opacities, and other MCQs is written that granule changes with patchy ill-defined opacity. Correct. Now, in transient tachypnea of newborn, there's cord-like, band-like structures radiating from the hyla on both sides. Band-like structures radiating from the hyla, and the mild hyperinflation of both lungs, and it resolves within 24 hours. Question number 3. So, patient has shortness of breath and hemoptysis. Chest radiograph shows triangular pleural base opacity in the right mid-zone with an ipsilateral effusion. What investigation most likely help in diagnosis? CT pulmonary angiogram. Okay. This CT pulmonary angiogram. Can you see this? Now, CT pulmonary angiogram is a normal lung, but the thing is that it's used in differentiating a lesion from pneumonia or infarct. To differentiate between pneumonia and infarct, we do CT pulmonary angiogram. So when there is a pleural base opacity in right mid-zone with ipsilateral effusion, then we do CT pulmonary angiogram. Question number 4. Shortness of breath. A high-resolution CT scan shows mosaic perfusion pattern. What is likely diagnosis? Chronic thromboembolic disease. In chronic thromboembolic disease, we have this mosaic pattern. What does mosaic pattern mean? It means that in some places there is hyperlucent and other places normal. But it means patchy hyperlucency in a normal lung or lung parenchyma is called a mosaic pattern. Just like this mosaic pattern, this is hyperlucency, and this is normal. So mosaic pattern seen in chronic thromboembolic disease. Next, this is okay. Mosaic pattern on it. Next question number 5. 28-year-old male with non-Marfan syndrome presents with chest pain and shortness of breath. An echocardiogram is performed. What are the most likely findings? Aortic regurgitation and dilatation. Marfan syndrome is associated with bicuspid aortic valve. On echocardiogram, when you see aortic regurgitation, most likely diagnosis, it is seen in Marfan syndrome. Then we will see aortic regurgitation and dilatation because it is associated with bicuspid aortic valve. So in Marfan syndrome, we will see on echocardiography aortic regurgitation and dilatation. Correct. Question number 6. In which structure does the thoracic duct normally drain? Junction of the left subclavian and internal jugular vein. The thoracic duct, it drains into the junction of left subclavian and internal jugular vein. Internal jugular vein, the subclavian vein, and between it drains. Correct. Thoracic duct drains into the junction between left subclavian and internal jugular vein. Next, question number 7. Okay. Question number 7. A 43-year-old man with previous history of polytrauma requiring a long period in intensive care for acute respiratory distress syndrome presents with shortness of breath. Abnormal chest radiograph prompts a high-resolution CT scan. What are most likely findings? Radicular changes in the anterior aspect of the lung. The important is that the patient has fat embolism because he had polytrauma, and now for this we do uh, chest radiograph and pulmonary embolism, and date changes is peculiar changes in the tumor aspect of the lung. See and date phase and appearance in long-term survivals of having fat embolism. CT appearance can be variable, but the important thing is that there is reticular pattern, coarse reticular pattern, and ground glass opacification in the anterior non-dependent part of the lung, considered more typical later stage CT appearance. The appearances of what? Fat embolism, late stage. Next question number. Remember the reticular changes in the anterior aspect of the lungs, which is the non-dependent part of the lung. Question number 8. In systemic sclerosis, what is the most common pulmonary finding on CT? Interstitial lung disease. Okay. Now, how is it? Because in systemic sclerosis, first there is sclerosis, which leads to fibrosis, and then interstitial lung disease. The systemic sclerosis, the most common pulmonary finding on CT is interstitial lung disease. Question number 9. A 28-year-old female presents with menorrhagia and dysmenorrhea. An ultrasound scan shows a large fibroid in the uterus measuring cm. An MR scan confirms an intramural fibroid with enhanced visibility. Patient undergoes uterine artery embolization, where the commonest complication occurring in the first 12 months following this procedure, post-embolization syndrome. Let's memorize it that after uterine artery embolization, within the first 12 months following procedure, most common complication is post-embolization syndrome. After embolization, the most common complication is post-embolization syndrome. Question number 10. Which feature on cardiac MRI would make cardiac sarcoid a more likely diagnosis than ischemia secondary coronary artery disease? Portal thickness abnormal IT2 signal with subendocardial sparing at the base of septum. Okay, now look here. This is cardiac MRI, and look over here that on cardiac MRI, on cardiac sarcoid there will be partial thickness abnormal IT2 signal with subendocardial sparing. This subendocardium is spared. Subendocardial sparing at the base of septum. So this is diagnosed cardiac sarcoid. In cardiac sarcoid, what will you see? Partial thickness abnormal high T2 signal with subendocardial sparing at the base of the septum. Subendocardial spared. In MI, myocardial infarction, we will see complete thickness high T2 signal. But in sarcoid, partial thickness high signal T2 with subendocardial sparing at the septum. Question number 11. Which of the following best describe the radiographic change seen in acute rejection of a lung transplant? Pure effusion and septal thickening with no left ventricular dysfunction. The important thing is that in acute rejection of the lung transplant, there is no left ventricular dysfunction. Left ventricular dysfunction only occurs in heart failure. Otherwise, in acute rejection of lung transplant, we will see pure effusion and septal thickening with no left ventricular dysfunction. Very important. Question number 12. The oblique fissure is seen to be bulging away from the consolidation, diagnosed Klebsiella pneumonia. The oblique fissure is bulging away from the consolidation. The consolidation, oblique fissure is bulging away, diagnosed Klebsiella pneumonia. Next question number 13. Which feature on CT scan would make a cavitarian malignancy more likely than an aspergilloma? Enhancing central mass. This calcification is not seen in malignancy but adjacent to it. Now on CT scan, which feature on CT scan would make a cavitarian malignancy more likely than aspergilloma? Enhancing central mass. In the other option, there is calcification, but calcification is not seen is not more common inside the malignancy, but is usually seen adjacent to it. To enhance central mass is the best answer to make a cavitarian malignancy more likely. Question number 14. Nose bleeds, pain and nose bleed, mild renal impairment. Chest radiograph shows multiple cavitary lesion diagnosis, renal granulomatosis. Now, chest radiograph, look, there are multiple cavitary lesions, and pain and nose bleeds diagnosis, renal granulomatosis. Multiple cavitary lesion on chest radiograph diagnosis, renal granulomatosis. Question 15. Increasing shortness of breath after road traffic accident, multiple long bone fractures, diagnosis fat embolism. Now these all hints are that there are multiple long bone fractures and increasing shortness of breath after road traffic accident, diagnosis fat embolism. Question number 16. Chronic asthma, most likely to be seen as normal chest radiograph. Chronic asthma most likely to be seen as normal chest radiograph. Question number 17. Painful wrist and ankle chest radiograph shows a well-defined coronal mass forming an obtuse angle with a chest wall. Well-defined pleural mass forming an obtuse angle with a chest wall. CT scan shows. Okay, so this is showing obtuse angle with lung. This is something else, empyema. But the thing is, look how an obtuse angle with lung is formed. An obtuse angle with chest wall will be something like this chest wall. This is pleuropharynx. And look, it is forming an obtuse angle with the chest wall. Okay, uh, avoid pleural-based enhancing mass with no bone destruction. They avoid pleural-based enhancing mass with no bone destruction. Here you got wrist and ankle show symmetrical parietal reaction. Diagnosis: hypertrophic osteoarthropathy with pleural fibroma. Look on chest radiograph, there will be pleural mass forming an obtuse angle chest wall. It means like with the chest wall forming an obtuse angle. Okay, and mass is forming an obtuse angle chest wall. And there on CT scan there's a wide pleural-based enhancing mass with no bone destruction. Then on radiograph wrist and ankle there will be symmetric parietal reaction diagnosed hypertrophic osteoarthropathy with pleural fibroma. Next, question number 17. How do you describe this? Pleural-based mass forming obtuse angle with the chest wall and show no bone destruction. Diagnosis: pleural fibroma. Number 17. Right side aortic arch with mirror image branching with which contain cardiac abnormality, tetralogy. A right side aortic arch is seen in tetralogy. This is right side aortic arch. This is what it looks like. Right side aortic arch seen in tetralogy of Fallot. Question number 19.